So very good morning, good afternoon, good evening everyone. So we are discussing about anti-hyperlipidemic drugs and we have discussed about statin. So I told you statins are HMG-CoA reductase inhibitors and they decrease the biosynthesis of cholesterol, and by the compensatory mechanisms liver will upregulate or more synthesize the LDL receptors, and LDL will be uptake by the liver cells more from the circulations, and due to that LDL level is going to decrease. So statins are a good drugs to decrease the LDL level, which is a bad cholesterol, right? Few more things about the statin is, as I already told, that could result in myopathies, rhamnolysis, GIT problems as well. And particularly statins have also other effects apart from their lipid lowering effects. So what are the other effects of the statins? They can be antioxidants, they have antioxidant effects, they have anti-inflammatory effects, they have anti-proliferative. So statin have a effects other than their main effect, that is your lowering the lipid levels. So these kind of effects, statin also do the antioxidant, anti-inflammatory, anti-proliferative. So these type of effects apart from its lipid lowering activity be called paleotropic effects. These be called paleotropic effects. It's also produce your antiplatelet actions as well, right? So these are the other effects of the statins apart from its lipid lowering activities, right? So another drugs under this one is anti-hyperlipidemic agents is cholesterol absorption inhibitors. Cholesterol absorptions inhibitors. And one more thing about the statin is it also can increase the risk of diabetes. Mellitus can also be increased because it decreases the insulin sensitivity, right? So cholesterol absorption inhibitors are the other class of the drugs in anti-hyperlipidemic drugs, and as its name indicates, they are going to inhibit the absorption of the cholesterol, right? So cholesterol is absorbed from your intestines, right? So there is a transporters, right? For example, these are the cholesterol molecules, so it's going to be absorbed. So there is a transporter proteins, that is the NPC1L1, right? This is the Niemann-Pick C1L1 like proteins. This is the Niemann-Pick C1L1 like proteins. And what is this protein? This protein is a transporter for what? Transporter for the cholesterol. It helps in the absorption of the cholesterol from the intestine, and then it reaches the systemic circulation. So what the drugs will do? Cholesterol absorption inhibitors will inhibit this transporter. So if you are inhibiting these transporters, cholesterol is not going to absorb. If cholesterol is not going to absorb, again by the compensatory mechanism, your hepatocyte will do the expressions of your LDL receptors on the surface, and more LDL will be going to be uptake. That is same mechanism, but it's a transporter, it's going to inhibit NPC1L1 transporters. And drug under this category is ezetimibe. Ezetimibe is a drug which is going to inhibit the absorption of the cholesterol from the intestines. Then another drugs under anti-hyperlipidemic drug is, third one is your bile acid binding resins. Bile acid binding resins. These are the resins, means polymeric compounds. Polymeric compounds contains positive charge and combining with negative charge lipids, bile acids, right? Bile acid binding resins. So these are the resins which are binding with the bile acids, right? So bile acids, and these are your resins. So, first you have to understand how bile acids are going to absorb, because it's going to interfere with anteriohepatic circulations of your bile acids. So what is anteriohepatic circulation? So as name indicate, anteriohepatic. So what is anteriohepatic circulations? Anterior means your cells of the intestines, right? Hepatic means your cells of liver. So anteriohepatic circulation. So that means your this bile acids, you know, this is your, for example, hepatocytes, right? And there is a gallbladder, it's release the bile acids, and these bile acids, this is the intestines, right? So this bile acids is going to bind with the fat soluble substances. For example, this is your bile acids, it combine with it, and again it will be reach to the livers. So this is be called anterior, then hepatic, then again circulation. So this is the anterior, then hepatic circulation. So it will be circulate like this. Bile acids will be goes to the intestine parts, bile acid will bind with the fat soluble substances, it will be absorbed and reach to again to the hepatic, and bile acid will again release to the intestines, right? So bile acid is playing a major role in the digestions of food as well. So in this case, these are the compounds which are the bile acid binding resins. So what these drugs will do? These drugs will bind with these bile acids in the intestines. Drug will bind with this and prevent its anteriohepatic circulation. So prevent its absorption. So bile acid is not going to absorb now if you are giving the patients bile acid binding resin drugs. So these resins will bind with the bile acids, and these, after binding with the drugs, these bile acids will not absorb back, not reabsorb back, right? So these with drug, it will be excreted out from the body. So now how it's helpful in the lipids, to lowering the lipid levels. So how it helps? These bile acids now is not reabsorb back. So what the liver will do in response to that? Liver will use cholesterol molecule to synthesize bile acids. So liver will now use the cholesterol molecules to synthesize the bile acids. So which is going to reduce? So cholesterol is going to reduce, because cholesterol is going to be utilized for the production of bile acid much more. So your cholesterol level is going to decrease, again compensatory mechanism, your body will sense it that cholesterol level is decreased, your LDL receptors will be expressed on the cell surface, your LDL going to be uptake more, right? So that is the same mechanism, but again little bit mechanism is different. Again, if I tell you clearly, so for example, this is your intestines, right? So normally what's happening? This is your liver, for example, and then there is a gallbladder, and they are releasing the bile acids. Normally what happens? You took the food items comes, these bile acids helps in the absorptions. There is a fat soluble substances, bile acid will combine with that and reabsorb, and then again that is the anteriohepatic circulations, right? So now bile acid binding resins are the drugs which will combine with the bile acids. So resin is binding with this, and this resin plus bile acid complex is going to be excreted out from the body. It will be excreted out. So if it's excreted out, so now there is a deficiency of bile acids, because bile acid is not recirculated. So liver will sense it, and liver will use the cholesterol for the synthesis of bile acids. So again this cholesterol level is going to reduce, because cholesterol is being used for the production of bile acids. So your LDL receptors is going to expressed on the surfaces, and it's going to do the uptake of LDL. So this is the mechanism of the drugs which are the bile acid binding resins, right? And these drugs are cholestyramine, 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 cholestyramine. These are the drugs which are the bile acid binding resins, right? Cholestyramine, cholestyramine. These are the drugs, and earlier we have discussed about cholesterol absorption inhibitor. The drug is ezetimibe, right? So this is the next category of the drugs. Then another category of the drug is fibrate. Under fibrate, there are drugs are fenofibrate, benzofibrate, benzofibrate. So what is the mechanism of actions of these fibrate is, these fibrate is going to act on the nucleus, right. So fibrate drug is going to stimulate nucleus, and particularly in nucleus PPAR alpha. PPAR alpha is peroxisome proliferator activated receptors. It's going receptor alpha. So these particularly fibrate is going to activate in the nucleus PPAR alpha. PPAR alpha is peroxisome proliferator activated receptors, and due to activation of this, it's going to do the transcriptions and translations. By the translation process, synthesis of more lipoprotein lipases. So more synthesis of lipoprotein lipases, and lipoprotein lipases is going to do the breakdown of free fatty acids. It will break down the free fatty acids, and these free fatty acids are important for the synthesis of your biosynthesis of your triglyceride. So that's why fibrate is very good drugs to reduce the triglyceride levels. Statins, other drugs we have discussed, these are the good drugs to decrease the LDL levels, bad cholesterol levels. If someone patients have a triglyceride much more, so fibrate is a good drugs to reduce the triglyceride levels. So how? The reason is because fibrate is going to activate the PPAR alpha in the nucleus, which is going to activate the lipoprotein lipases. Lipoprotein lipases is going to do the breakdown of free fatty acids, and free fatty acid which is important for the productions of triglyceride. So if free fatty acids are broken down, so your triglyceride, ultimately your triglyceride level is going to decrease. So that's why if question is asked which of the anti-hyperlipidemic drugs is useful to reduce the triglyceride levels, fibrate, fenofibrate, benzofibrate, any fibrate, these are the useful drugs to reduce the triglyceride levels. But statins are not that much effective to reduce the triglyceride level. Statins are the drugs which are useful to decrease the LDL, right, bad cholesterol. The reason is this. So these are the mechanism of actions of your fibrates, right. So these drugs we have discussed so far quickly. Anti-hyperlipidemic drugs, the drugs which we have discussed so far, few words about these drugs. Hyperlipidemic drugs, we have discussed about statin, and statins, one important point which I have told you with respect to MCQ is, don't consider कि जिन ड्रग्स के पीछे स्टैटिन लगा है वो सारी ड्रग्स कोलेस्ट्रॉल के लिए ही है. These all drugs may or may not be your HMG CO reductase inhibitor. Example, I told you that there are some drugs which have a statins, but they are not the HMG CO reductase inhibitor. So what you have to remember is, in every statins there is a, like if we write Rosuva, Va is there, right? If we see the spelling of Simva, Va is there, then statin, right? If we talk about Fluva, then Fluva is there, Va statin, right? If you talk about atorvastatin, Atorva is there. So you have to remember, if there is a Va and then statin, these are all are HMG CO reductase inhibitor. Otherwise it may or may not be. I have told you there is a one hormone as well, like somatostatin. There is a statin in the last, but there is a Va is not there. So that is not your HMG CO reductase inhibitors, right? Cilastatins, your tempostatins, these are all other drugs. Then we have discussed about cholesterol absorption inhibitors, and under this ezetimibe. And then we have discussed about bile acid binding resins, drug under that category we have discussed cholestyramine Cholestyramine, styramine is also another drugs. Then we have discussed about fibrate. Fibrate are the drugs which is going to reduce the triglyceride levels, right? Triglyceride levels. So this is all about your anti-hyperlipidemic drugs. Other classes under this category is your vitamin B3, that is the niacin or nicotinic acids, other new drugs that we will discuss in upcoming videos. Thank you so much.